Happy Tuesday, everybody, our Thrive Mom community. We are so excited to be back at our pediatric specialties. I think, Lisa, you did a PT for us last year, one of our first ones in 2022. So we're excited to be back here with you, and we're in the super fun room here, and we are talking today about a topic that I struggle with my little ones, and it's shoe fitting. Finding the right shoe, making sure it fits right, how to figure that out, what to look for. And Miss Lisa Crilly, our pediatric PT, is going to educate us. So throw your questions in if you have comments, questions, places you've shopped at, anything you want to share with us, please do. And with that, I'm going to pop out into the hall.
Awesome.
You get to, if it goes dark a little bit, you might just move the mouse.
You got it. I can do that.
Okay.
Thank you, Danielle. And I appreciate Danielle reaching out to our Center for Child Development and our therapists here, because I think the more we all share from whether it be with motherhood or professionally or both, the more we can all benefit. So I was asked to talk about shoes today, which is very often a topic that comes to my attention whenever I'm working with children here at the Center for Child Development, but also personally with my own children, my own grandchildren throughout the years. And I was trying to figure out a way to start today, just for the few minutes that I have with you. And I thought I would just talk about some simple foot development, okay, so that parents are aware. When we're talking about the feet, we're talking about three parts of the feet that need support. One would be the hind foot, which all of us basically understand as the heel, okay? The next would be, if I use my hand as an example, so it would be the heel. The next would be the midfoot, okay, which would include our arch, our medial arch on the inside and our lateral on the outside. And then there is the forefoot and toes, okay, that is the most distal part of the foot. And a proper shoe should at least provide support encompassing those three areas of the foot. When we want to talk about appropriate support, we want to make sure that that hind foot, that heel, is stable in that it's not rolling inward or it's not rolling outward, but it's stable so that it provides a basis support, a stable basis support for neutral alignment in the ankle, knee, hip, and trunk. Okay, so our trunk should all just come down. So sometimes our children may have what we call a little bit of pronation of their feet, or the turning in or collapsing of the arches. And with those children, sometimes you might need something a little bit more fitted of a shoe that might be indicated, okay? But if in question, you can ask your pediatrician, and the pediatrician can always refer to physical therapy to help you assess that. We have our physiatrist here at the center who also assists with that too, Dr. D'Alessandro. The biggest thing with providing information about shoes is knowing that we have certain types of shoes that might be appropriate at certain times. This would provide a shoe like this is like a New Balance. It does provide you with a little bit of a wider shoe. It provides you with that hind foot stability where it's not too mobile, okay? And then it provides you with that medial arch stability, but allows that forefoot to be flexible a little bit during, I'm hoping you can see me on here, during that toe-off phase of gait. Flexible during that toe-off phase of gait, okay? So we want a stable hind foot, a little bit of a support on the medial arch, and a little bit of flexibility toward the toe, okay? What parents worry about is my child's foot too flat. We don't talk about arches for a child until naturally occurring arches when our child's feet between the ages of 2 and 3. So most children are flat-footed. It's the idea of locking into what we call pronation, or locking into that hind foot outwardness and that flat-footedness that has become a little bit more of a concern, okay? So when looking for a shoe, we like to look at a couple of parameters. A lot of parents will say to me, at what age should I start to wear a shoe? So, we all have these pretty little dressy little shoes that infants wear. Those are adorable, and you can wear them, and that's fine. Barefoot for development is crucial. It really is crucial. But when a child gets to the age of about 11 or 12 months, you usually go and get them fitted for a good pair of supportive sneakers, okay? I'll often say to my parents, make sure that it's a true to fit, meaning if I measure a 4, get a 4. It may require that you get an extra pair of shoes a year. I understand that. I'm a mother myself, and I know how expensive things are. But if you get too large of a shoe, then it can cause tripping, and it doesn't provide the support that you'd like. Especially if the child has any type of delay in development, you truly want a true to fit shoe. Okay, and this should be done at a good shoe store that can provide a stride right, that can provide an assessment for the shoe, for the size. When you're looking at the shoe, you're looking at, again, the hind foot. You're looking at, for the forefoot, you're looking at the toe box. So this one has a little bit of a rounder toe box. This one has a little bit of a triangular shaped toe box. Again, it depends upon the child and it depends upon the needs. But either could be okay. Again, depends upon the child. Okay. They have some neat ones called high top shoes, okay? And they can be used for our children. You just want to watch that they're not too clunky. Again, it's all individual with the child. If the child is a little bit petite, then your high top shoes may be a little bit more clunky for the child to be able to efficiently have that heel to toe pattern. And it may cause a little bit of toeing in or toeing out and such if it's a little bit too much of a shoe. So what I really stress for you guys is to go to a good shoe store, have a relationship in that the person who measures you will really watch the hind foot, midfoot, forefoot, try on a couple pair of shoes, and really have the child walk with them. The child should walk with ease, should be able to be stable in the shoe, and should be very, very comfortable with the shoe. Would love to at this time see if maybe we have some questions or some areas that I did not cover. Okay, let me see if I can call Danielle. I'm going to open the floor to any kind of questions.
So anyone have questions, throw them in. I have a couple questions. So it's summertime, right? Do our kids need shoes? What about sandals? I know my little ones have those ones with their flip-flops and they strap around the back, and my dad is constantly mocking me that those are not appropriate. He is not a pediatric PT though, so I can't trust his mockery. What about summer shoes?
Okay, so we happen to have these cute little things, all right, which are adorable. This is their open toe shoe. The biggest thing is we like to prevent a lot of tripping for the little ones, okay? They move fast in the sand, they'll move fast in the playground, they'll move fast on concrete, and the description of what you said are adorable, but technically they do not provide enough support for a little one to be jumping all over the place and such. That being said, I like the ventilation. I like that you can get them a little sandy and you can shake them out and put them out. But this does provide the support that I described before. That hind foot stability, a little bit of the support to that arch, and then that forefoot flexibility, but stability also, okay? So I do like the open straps and such. You know, when little girls and such, boys get a little older, they like to be a little bit more cosmetic and such, and like of their choice. But at that point, usually, if there are no specific delays, then you know the risk of falling becomes less and less. But for little ones from age 1 to 3 and such, these are a nice choice. Okay.
Awesome. So that answers this one question. What sandals are recommended? So more of the open ones and that.
Awesome. And the other thing it brings too is I love water shoes. Love water shoes, because water shoes are like this. You just slide them on, you know, and you've got to dry them out and all that stuff, but they have a neat sole. And if you live in a lake community, I have access to a lake community. I love my grandchildren and such to have some sort of support to the feet. Stepping on shells, if you go down to the seashore, it's just not a good thing. So I love water shoes. Water shoes are awesome for children too.
Awesome. Okay. So My kids are constantly wanting to run around barefoot. Should I? What are your thoughts on barefoot?
I think barefoot's awesome. Okay. And again, everything's balance. Everything's a balance. Okay. When you go outside, when you go in the grass and things like that, you should have shoes on. Okay. But in the house, I don't know about you, but I come home and I take my shoes off. Okay. Barefoot time is essential for that proprioceptive awareness, balance awareness, utilization of ankle joint, forefoot, and such for all kind of balance receptors. Barefoot is wonderful. But once again, just like everything else, everything is a balance. Okay.
Awesome. Can you tell us the brand of this one? This little green one? Oh, I think it's Oshkosh.
Yeah, this one does look like an Oshkosh. I know Stride Right makes a cute one too, but this one isn't Oshkosh.
There's a little shoe store in Ridgewood that my mom loves taking my kids to, and they fit them and they measure them, and that one's really awesome. I'll find a name for that.
Oakland too.
Okay.
Oakland too. Am I allowed to say names?
Yeah.
Giblings in Oakland.
Okay. Oh, I've heard of that.
Wonderful, wonderful shoe store in Oakland.
I think the one in Ridgewood is the Bootery.
Yes.
The Bootery.
Yes.
Yes. I've heard they're great.
But again, you keep it simple. These are people that fit you. Take the time to really, answer questions and allow the child to be, fitted with what they think is appropriate. Because, I could sit there and say, I like these and I don't like these, but then a child comes in and it's not as appropriate for others. New Balance tends to be a little bit wider. Nike tends to be a little bit more narrow. I love both shoes. I love a Nike shoe. I love New Balance shoes. Depends upon the child. Okay.
Awesome. Is there a certain brand of water shoe that you recommend with a good sole?
There's not a brand that I'm aware of. No, there's not. I do know most of the main shoe companies do make their own version. I think I saw Lanzen had it. I believe Lanzen had it too, if I saw in a catalog, and those are very nice too.
Awesome. Good, especially for wide feet.
Especially for wide feet. Yeah, wide and narrow, but I mean, you need to protect the soles of the feet, okay? And, again, barefoot in the water is an awesome thing, depends on what water. Lakes, and the ocean, I tend to like to protect the feet a little bit with shells and such, okay?
Awesome.
However, there's a lot of my children who maybe have a little bit of developmental delays and such, that just barefoot walking in the sand is a great activity. So again, everything in balance and just seeing what our goals are at the time. If it's to protect the feet, because you're concerned about all the seashells, you put the shoes on. If it's as an exercise and to get that sensory and that strengthening of the toes and ankles, then get the bare feet. Okay?
That's awesome. Oh my gosh. See, I knew this was a topic that we all had so many questions on, right?
Yeah.
All right. Well, that was fantastic. Thank you so much for all the information. We so appreciate having you. And if you have come up with more questions or want to chat more about brands and shopping experiences, throw them in the comments and we can all chat another time. Thanks for popping in.
Bye-bye.